Hello, I'd like to welcome everybody to the NCVHS Predictability Roadmap webinar. Thank you very much for joining us today. And before we get started, I want to take a moment to go over just a few administrative details. As you have noticed upon joining the webinar, everyone has been placed on mute for the presentation. At the end of the presentation, there will be a Q&A session. So in your GoToMeeting control panel, you will see a questions box. Please type your questions or comments into the field and hit enter. If we don't have enough time to do all of your questions at the end of the webinar, we will follow up with you afterwards. So please, we really want to know what you're thinking and what you have questions about. Please note that the recording of this webinar, along with the slide deck, will be distributed to all of the attendees following the live webinar. So you will be getting a copy of the slide deck as well as the link to review the recorded webinar. Now I would like to introduce WEDI CEO and President Charles Stellar to make a few comments.
Yes, good morning. I hope everyone can hear me. I want to thank you for joining the webinar today. This is a great opportunity for us to hear from someone who knows these topics and the work of NCVHS well, Deb Strickland. And Deb has agreed to present the information to us so that we're all fully briefed prior to the WEDI PAG, which will be held next Wednesday in Washington, D.C. So with that, I want to welcome everyone and also to thank Deb for providing this webinar for us. So with that, Samantha, I'll turn it back to you.
Thank you, Charles. And just once again, now I'm handing it over to Deb Strickland. She's our presenter today. She's a longtime X12 and WEDI member and is now on the NCVHS committee. She'll be presenting for us that committee's predictability roadmap. Deb, it's all yours.
Yes. Thank you so much. Thanks, Sam. Thanks, Charles. Happy to be here. I'm hoping to shed some light on our draft recommendations and hopefully get some feedback from you all as well, whether it be through questions and answers or your written feedback and testimony. So today, what we're going to do is we have four main objectives. Give you a brief historical review of our predictability roadmap efforts to date. We started the most recent effort early in 2017 and have made some really great progress. We're going to present the detailed draft of our recommendations. Now, this is going to take the bulk of our time. So we will go over all of the recommendations, and then if we have time for the Q&A period, we'll do that. But we want to make sure that we get through all of the recommendations. And then we're going to review what our next steps are and what the timelines are. This will enable us to get discussion, industry perspectives, and thoughts that emerge from our member engagement, and also through your written, formal submitted written testimony. So this is going to support the standard subcommittee's formalization of these recommendations. They're just draft right now, but we want to get your feedback on this. And then we're going to be able to formalize that and deliver that to the secretary and the industry as appropriate. So when we get to slide 16, we're a long way from there, we will provide critical information for you on how you can comment. All right, let's get started. So to ensure that we have the same understanding, I'll first explain exactly what we mean by the predictability roadmap. I'll do this by covering at a very high level what the problems are we're trying to address, and why might a predictability roadmap help us to address them, and how the roadmap's been developed, basically what we've done to date. So the word predictable has several meanings and extensions here. So let's go ahead and review why we're here. So the first bullet is standards development, adoption, and implementation are not predictable and are not keeping pace with the business and technology innovations. The Predictability Roadmap is an initiative to evaluate barriers to the update, adoption, and implementation of standards and operating rules under the authorities of HIPAA and the ACA. So for the past 18 months, NCVHS has been collaborating with industry stakeholders to understand the challenges and develop actionable recommendations for the Secretary of HHS, covered entities, standards development organizations, and operating rule entities. Industry stakeholders include all parties involved in the process, from standards development organization, coordination in government entities, entities that are responsible for establishing the statutory framework, and the software system developers who must build the rules and capabilities into their system, and to the end users who run healthcare businesses every day and use these standards every day to operate their business. So let's take a look at the vision. So for covered entities and business associates to be able to use up-to-date HIPAA standards consistently, garner increased value from the standards by avoiding one-off workarounds, and to reliably know when updated versions will be available, and adopted in time to prepare the systems, resources, and business processes. I'm going to stipulate that administrative standards have significantly improved efficiency of the healthcare system. While maybe not immediately, over time it certainly has. However, our pace and change for this industry, individual business challenges, and technologies continue to advance faster than our ability to keep up. By enabling a more predictable and flexible roadmap, we hope to address these challenges. This is a very busy slide. But this slide at a high level represents the process of advancing standards. So it starts with a need being identified within the healthcare community. That need is then taken into the development of work of the applicable standards body for vetting and incorporation into a transaction standard or an operating rule. Work products are then ready for national use, are vetted by government groups. In the case of transactions, the recommendations to adopt first go through the Designated Standards Maintenance Organization, or DSMO, for review and advancement to NCVHS. NCVHS processes advance the formal recommendation into the HHS processes. Now, operating rules kind of skirt that whole process and just kind of go directly to NCVHS. By way of background, the existing regulations require the involvement of that Designated Standards Maintenance Organization for transaction standards. The DSMO was created by final rule in August of 2000. The genesis for this was Industry Oversight Group. This was included in Title II, Subtitle F, Part C, Section 1172 of the HIPAA Act. That section also recognizes the role of WEDI and NCVHS. So keep in mind as we go through this discussion that standards are developed or updated in response to business needs. Industry brings forward their needs for consideration into consensus-based processes. Often these are accredited by the American National Standard Institute for incorporation into a transaction and implementation guides. The operating rule entity provides additional business collaboration to constrain standard implementation guides. This garners further efficiencies from the use of the mandated standard. So it takes it just one step a little further. And then the roles of WEDI and NCVHS provide additional public vetting and synthesizing of the policy and implementation considerations and perspectives on the national standards. Then HHS CMS's Division of National Standard is responsible for regulations related to HIPAA transactions and the operating rule standards. The Predictability Roadmap is focused on medical and pharmacy transaction standards body, including the EFT standards, plus operating rule authorities adopted under HIPAA and the ACA. So in other words, the standards development entities listed on this slide, and we'll use the term SDO to collectively refer to this group. To develop the Predictability Roadmap, we undertook information gathering with organizations shown on the slide, plus a workshop that included interested stakeholders like the Defense Health Agency, Military Health Systems, Veterans Administrative, Optum, and Blue Cross Blue Shield Association. We also engaged with coordinating and government entities. like the DSMO members, National Uniform Claims Committee, National Uniform Billing Committee, Dental Content Committee, HL7, X12, the National Council for Prescription Drug Programs, and of course the Work Group for Electronic Data Interchange. We also engaged with HHS CMS's Division of National Standards. DNS is responsible for updating the transaction and operating rule standards for use by covered entities and their business partners, those partners being providers, health plans, and clearinghouses, as mentioned on the slide before. So these are all representatives that participated in the workshop and one-on-one session to ensure that we have a clear understanding of the federal processes. So what happened? So our information gathering affirmed feedback loops since the initial implementation of the 9 HIPAA adopted transactions. This included 2006 and 2009 DSMO and standard body white papers and numerous hearings with industry feedback, such as the review from the committee hearing. So 5 themes emerged from all of this. Governance, that's related to the DSMO and the NCVHS processes. Updates to standards, this is related to the SDOs. Regulatory process, related to HHS and CMS processes. Data harmonization, related to concepts of data convergence and interoperability. Now, this theme is going to be addressed under the subcommittee's terminology and vocabulary project. And then third party as covered entities, related to who and how they're obligated to use the transactions and operating rules. So to enhance our understanding and opportunity areas, we convened a diverse group in what's called the CIO Forum. Think of this group as, the leaders across the end user community. These are front of the line providers and their EHR and practice management vendors, health plans, clearinghouses, thought leaders, federal partners from ONC and CMS, all the folks that are delivering or enabling and paying for healthcare. So we solicited the feedback presented in the 5 themes discussed on the prior slide, with each section providing an introductory overview and specific questions to prompt our discussions. So the very robust dialogue validated that there is benefit in having transactions and operating rule standards, and that significant efficiencies have been achieved since the pre-HIPAA paper days. We can all admit that. And that opportunities exist to garner more benefits by revising or enhancing the current approaches to keep pace with the strategic initiatives of the healthcare industry. It also underscored the importance of the following 7 points. So improving the current processes, but to do so with consideration of tomorrow's business models and technology capabilities. So we've got to be mindful of what's coming. Value of avoiding technical debt and throwaway work. We don't want to keep recreating the same wheel. Having a focus of putting the patient at the center. Diverse end user engagement in standard development and governance is essential and needs to be made less painful and less expensive. Smaller iterations and a predictable cadence that supports backwards capabilities. Becoming more evidence-based in standards development by incorporating empirical testing and pilots that generates learning and supports better development of adoption. And all actors in the ecosystem being clearly obligated to comply with the standards and data protection obligations. So the dialogue also reflected that we had a strong agreement that there is no meaningful differentiation of clinical and administrative data. So it's time to create a path towards integrating those standards. To sum this up, the CIO Forum input resonated for the subcommittee in 3 categories: transparency, measurement, and collaboration. So over the summer, we synthesized and framed the input into recommendations, calls to action, and measurement objectives. We also worked on the timing and interplay of the ideas and how they affect change. As we undertook these activities, we listened and challenged participants to not only tell us what the challenges were, but what might be done to make the process better. Several goal areas for addressing improvement, along with general tactics to improve predictability for each goal area emerged. So improvements for the federal process, more visibility of enforcement of existing regulations, more frequent guidance and outreach to industry, improved responsiveness to NCVHS recommendations, and timeliness of regulatory activities. Improvements for SDO processes, increased diversity of industry participation in standards and operating rule work groups, improved timeliness of standards development to support innovation and evolving business and technology changes, improve work group processes for productivity, and governance and oversight, which is stewardship, transparency of processes, both federal and SDO, and advancing industry needs and garnering value from standards. So, as a result, our outcome goals are to improve education, outreach, and enforcement. This will promote efficient planning and the use of adopted HIPAA standards and operating rules. Policy levers will successfully support the industry process improvement changes, and regulatory levers will enable timely adoption, testing, and implementation of updated and new standards and operating rules. So we gave this a good deal of thought regarding how we might frame up our recommendations. So we categorize the recommendations into 3 distinct groups of items. Recommendations, these are generally geared towards the secretary. Calls to action, these are geared towards the industry. And measurements, how we might define and measure progress and success. So some of the recommendations are standalone, but some are codependent on more than one item being addressed, either concurrently or sequential, being dependent on other items being addressed in order for that recommendation to be valid. So we have several busy slides coming up, and I will be flipping through them back and forth so that we can cover each one of the recommendations, calls to actions, and measurements. We also consider the complexity of the items being implemented as well as the likely timeframes which the recommendations could be implemented. As you can see, we have the different timeframes above. With these considerations, we categorize the tactics into general outcome goals, as you can see on the screen. We also bucketed these general outcomes into time buckets to give a picture of how these recommendations could be addressed concurrently and sequentially. Our objective was to keep the vision big and transformative, while at the same time recommending items that could be implemented more rapidly, but to gain benefits over time. So let's take a look first at the 2019 and 2020, the Improved Education Outreach and Enforcement slide section. Number 1, HHS should increase transparency of their complaint-driven enforcement program by publicizing de-identified information on a regular basis. HHS should use all appropriate means available to share de-identified information about complaints to educate the industry. This is where learn from others' mistakes. Someone might be making a mistake that they didn't realize was a mistake, and by publicizing and educating the community, it spreads the education. HHS should comply with the statutory requirements for handling complaints against non-compliant covered entities and process enforcement actions against those entities and their business associates. Information should be publicized about the status of complaints to the extent permitted by law. HHS should regularly publish and make available guidance regarding the appropriate and correct use of standards and operating rules. Okay, as I mentioned, we're going to be flipping back and forth here. Now we're going to enter into the 2020 to 2021 box in the center. Item 3, HHS should disband the designated standards maintenance organization and work with its current members for an organized transition. So as we mentioned before, nearly 2 decades ago, there was an approach to which was designed to oversee the way that the transactions related change request impacted covered entities would be handled. The belief was that a centralized approach would promote trust and that the funneling of potential changes through a vetting process would further administrate simplification, efficiencies, and standardizations. But for a variety of reasons, the funneling of the changes didn't occur as planned. So the industry basically took all of the change requests and went directly to the SDO that it applied to. Further, operating rules don't even go through the DSMO process. So number 4, HHS should enable the creation of an entity tasked with oversight and governance, stewardship, of the standards development processes, including the evaluation of new HIPAA standards and operating rules. HHS should provide financial and or operational support to the new entity to ensure its ability to conduct effective intra-industry collaboration, outreach, evaluation, cost-benefit analysis, and reporting. Oversight criteria would take into account ANSI essential requirements for any ANSI accredited organizations. These would also provide consistency to governance of all standards and operating rule entities. We've learned a lot of lessons since HIPAA, HITECH, ACA, and more, and these lessons include, but aren't limited to, the value of the public-private partnerships and the importance of funding key initiatives and the importance of education and evaluation to actually demonstrate that there is value and to create buy-in. Number 5, and hopefully you can see that on screen, HHS should conduct the appropriate rulemaking activities to give authority to a new governing body replacing the DSMO to review and approve maintenance and modifications to adopted or proposed standards. A challenge experienced by the DSMO, funding dynamics aside, was that they had limited authority. So we need to give this entity the appropriate level of authority. And at times, HHS and CMS rulemaking was reopened prior to consensus-based work efforts. And the duration of federal rulemaking to adopt maintenance and modifications is lengthy and beyond key milestones. It's basically hidden from public view. So 8, center column, HHS should publish regulations within 1 year of a recommendation being received and adopted by the Secretary for a new or updated standard or operating rule in accordance with what is permitted in 1174 of the Act. HHS should ensure that the operating division responsible for education, enforcement, and the regulatory process is appropriately resourced within the department. Now we're going to pop over onto the far right column. This is the 2021 to 2024 regulatory levers. So the SDOs and operating rule entities should publish incremental updates to their standards and operating rules to make them available for recommendation to NCVHS on a schedule that is not greater than 2 years. Publication of a new or updated standard is intended to mean the cycle of preparedness that meets ANSI requirements for maintaining or modifying a standard or operating rule, including the consensus process, necessary governance, compliance, and readiness for submission to NCVHS. NCVHS should align its calendar with the SDO or operating rule entity updates to review and deliver its recommendation to HHS within 6 months. HHS should adopt the NCVHS recommendations on a regular schedule. HHS should adopt incremental updates to standards and operating rules. In accordance with Section 1174 of the Act, the adoption of modifications is permitted annually if a recommendation is made by NCVHS and if updates are available. Since the adoption of the original HIPAA transaction standards, there has been one major upgrade and some errata. HHS should publish rulemaking to enable the adoption of a floor or a baseline of the standard and operating rules. This rulemaking should also consider other opportunities that advance predictability and support innovation. So in today's model, what we have is the ceiling approach. This means the maximum is adopted. This limits innovation and incremental modifications to the data exchange. HHS should enable voluntary use of new or updated standards prior to their adoption through the rulemaking process. Testing new standards to enable their voluntary use may be explored by testing alternatives under 162.940, exceptions from the standards to permit testing of proposed modifications, and the purpose of this recommendation is to enable innovation. So in today's structure, to legally use a new or modified version of HIPAA by a covered entity, there has to be a request for an exception. So now we're looking at draft calls to action. This is, we're going back to the 2019 and 2020 column on the far left. Health plans and vendors should identify and incorporate best practices for mitigating barriers to the effective use of the transactions, determining which issues are most critical and prioritizing the use cases. So as you can see, we've shifted off of recommendations to calls to actions. This is, again, to reflect opportunities for the industry to improve processes. So as the primary drivers of transaction usage, we've got health plans and vendors, and through their collaboration, may hold insights that could advance the administrative simplification. The Workgroup for Electronic Data Interchange, through its workgroup structure, should continue to identify issues and solutions. WEDI should publish white papers advising upon agreed upon policy implications, best practices related to the HIPAA standards and operating rules. So convening this diverse and competitive group of folks within the healthcare ecosystem is a great way to help us to achieve our national goals. The SDOs should consider collaboration with the private sector to plan and develop outreach campaigns with the intent to increase the diversity of participants in the standards development work groups. And leadership from public and private sectors, on the flip side, should commit the membership to the standards development organization, assign the appropriate subject matter experts to participate in the development and update process, and to facilitate improvements to operations as needed. This may enhance diversity of the representation at the SDOs so that the content changes meet a cross-section of the stakeholder needs. So again, we don't want to know during public comment period that we've got major problems because those people weren't at the table. So we're trying to get a more diverse group of folks sitting at the table at the time. And now we're going to take a look at our draft calls to action for policy levers. In the second column, 2020 to 2021, HHS and the SDOs should identify and fund the best of class third-party compliance certification and validation tool recognized and approved by each standards development organization to assist in both defining and assessing compliance. HHS should develop the test criteria for certification and build a program that to enable multiple third-party parties to qualify to conduct validation testing by demonstrating their business value. To implement this recommendation, HHS should look at successful precedents as to how the ONC certification criteria was developed for promoting interoperability and the e-prescribing requirements, which were a joint effort between HHS, NIST, and the SDO. So now we're looking at G in the center column. Public and private sector stakeholders should collaborate to design a single coordinated governance process. Governance should include detailed and enforceable policies regarding business practices, including policies for identifying and implementing best practices in such an organization. Earlier recommendations address modernizing the concept of DSMO. To that end, it's important that the industry actively gets involved and participates in designing that effort. Okay, we're going to move on to the far right column, 2021, 2024, the regulatory levers. HHS should fund a cost-benefit analysis of HIPAA standards and operating rules to demonstrate their return on investment. HHS may consider collaborating with or supporting any existing industry initiatives pertaining to such cost-benefit studies to increase data contribution by covered entities and trading partners. So that's really to maybe try to get more robust data involved in those studies, maybe make them a little bit more consistent with what we're seeing in the industry. HHS should continue to publish a universal dictionary of clinical, administrative, and financial standards that are or will be available for use. For example, ONC's Interoperability Standards Advisory. So as we noted, there's a strong agreement that there is no longer a meaningful differentiation between that clinical and administrative data. So this is the time to create a path to integrating the standards, and incorporating the administrative and financial standards into the Interoperability Standards Advisory represents a small step towards that convergence there. So at this point, HHS's Federal Advisory Committee, which is NCVHS, and ONC's Federal Advisory Committee, which is HITECH, are collaborating in regards to objectives in the 20th Century Cures Act. Okay, now we're going to move on to the recommendations for measurements. We're going to go back to the left-hand box. So here, HHS should publicly and regularly disseminate results of its enforcement program to promote transparency, opportunities for education, and benchmarking. Center column, HHS and stakeholders participating in the new governance process should establish metrics for monitoring and performance assessment of the new entity and oversight enforcement of the SDOs and operating rule entity deliverables and performance. So if we're going to modernize this approach, the stewardship approach, then we also have to ensure that we're capturing and applying the facts and evidence to effectively manage and advance the development and use of those standards and operating rules. NCVHS should continue to conduct its stakeholder hearings to assess progress of the predictability roadmap. NCVHS's history speaks to our ability to receive, process, and advance industry views and leading to healthcare policy data policy improvements. So, as next steps, we have activities planned for the fall. It's shown on this slide, and the next step is to ensure that we obtain and incorporate the full committee's input. Please be sure to send any further input on the materials and from today's presentation. The subcommittee will then finalize the recommendation and formalize their recommendations to advance them from draft. So we have September 14th, NCVHS discussed the draft recommendations with the full committee. October 1st, NCVHS finalized and distributed the slide deck, narrative, document, and hearing questions. October and November, this is where we are now. We are having the stakeholders all vet the draft proposal. We will gather input. We will gather your testimony, anything that you would like to write to us and on comments on any of these draft recommendations. And then December and January, NCVHS will incorporate the feedback from our stakeholders. February 6th and 7th, NCVHS will conduct the full committee meeting. And in the first quarter of 2019, NCVHS hopes to release a letter to HHS based on the review and the vote of the final recommendations. So this is the all-important slide where to send your comments. Submit your comments to NCVHS mail, that's all one word, at cdc.gov with the subject line, Predictability Roadmap. Please include your name, email, and organization. So some of the questions that you might consider as you are formulating your written testimony or comments. So one is, would these recommendations as a whole improve the predictability of the adoption of administrative standards and operating rules? 2, what additional recommendations are critical to achieve predictability? What is the value proposition of each recommendation? And what improvements to the current state do you believe will arise from each recommendation or group of similar recommendations? And are there any unintended consequences? What are those and how can they be mitigated with modification to these recommendations? Those are all food for thought questions as you evaluate these draft recommendations, things to think about and review. Perhaps these are good things to review during the PAG. And hopefully this highlight of the recommendations has been informative to you and preparing you for attendance of the Policy Advisory Group. Sam, any questions?
Thank you very much, Deb. We do have a few questions.
Okay. I hope I can answer them.
There are a few that are pretty long. Let me see if I can find one that isn't. Okay, slide 13, action F. Are the subject matter experts expected to be experts from the business perspective or technical perspective, or both? The business perspective is seen as critical from the ADA's perspective, as the standards and technical solutions can and do help dentists deliver care to their patients.
Yes, I would think it would be both, because we do need both sides of that, as you know, as they are both very important, and in administrating, you know, the standards and improvements to them. Yes, I'd say both.
Thank you. And another question. Regulations is plural. Does the 1-year time frame include a NPRM and final rule?
We're not sure at this point. We are, you know, if the final recommendation is to request these things, those things may have to be shortened, or we may have to have different processes altogether. It remains to be seen at this point.
Thank you. Another question coming in. Why would the standards cost benefit analysis not come before making changes?
Well, we want to reflect. So part of it is, yes, we would want to make sure that you do some level of cost benefit before the change is made, but then also to sort of reflect back on what did this change really do in real life. And, you know, we do have some cost benefits out there in the industry today, but they're sort of in the beginning, but they don't actually bring up the rear to say, did that really happen? So that's really what we were looking for there, is how did that really play out? Did that really give us the benefit that we anticipated when we started this?
Thank you, Deb. Again, if anybody has any questions, feel free to enter them into the questions box. Oh, another one. Can you describe the intended replacement to DISMO, like staffed by HHS or volunteers from industry or SEOs?
Yep. So we are leaving that open. Again, that whole structure, we do want feedback from the industry, the public, to define what that is. What does DISMO look like? You know, what do you think needs to be in there? So in creating this new DISMO, let's think about it critically and say, well, what do we need from a governance or stewardship entity? It may be all of the above. It may be public-private sector, it may be SDOs, and it may be some HHS representation. We're leaving that to folks to provide input and to give us some guidance as to what things you think that overstructure should look like.
Thank you, Deb. And Charles, I know we have some other weedy leadership on this call. Would anybody like to make any comments or any additions?
Sure. Hey, Deb, this is Lori Darst. I have a quick question for you. On slide 12, the number A or letter A, health plans and vendors should identify and incorporate best practices. Just wondering why the provider stakeholder group was left out of this recommendation.
It probably was inadvertent. It's not like we want to exclude anybody.
Okay.
Go ahead, Jay, did you have something?
No, I'm set, Deb. Thank you.
Okay, great.
We've got another question that just came in. Does NCVHS currently have, or through this recommendation, create any helpful criteria for vendors to dedicate some resources towards working and being involved in standards organizations?
We do not, but I mean, can you say the last part again? What are you looking for as far as the recommendations and structure?
Does NCVHS currently have, or through this recommendation, create any helpful criteria for vendors to dedicate some resources, SMEs, towards working and being involved in standards organizations?
We really don't. We're leaving that up to the individual entities to sort of do some research and go into the different organizations to try to figure out where and how best they want to play within these standards organizations, what's meaningful to them, what affects their products, where they think that they're going to have the most benefit to themselves, and where they maybe have gotten impacted negatively by something that happened that they didn't have any participation, or they didn't participate in a public comment or a group or something like that. So it's really individual to the entity to figure out where they want to play and where they need to pay attention. What's difficult in some times is that there are so many organizations to spend time and work in, but if you can sort of spread your resources out appropriately so that they can cover the various areas within these standards organizations, that would be the best thing to do.
Thanks, Deb. Another question. When must written feedback be received by NCVHS in order to be considered?
Good question. I believe that is the 13th of November. But that said, we have the whole period. So we do have, we want comments back by the middle of November for the hearing in December, but then we will continue to take any comments that you might have, because we also have to, once we have the hearing and we have all the very active and robust discussion, which I'm sure we will have, then we will take that information and we have to synthesize it through the December-January timeframe. So, keep it coming. You have through December and January to also offer up your comments.
And in addition, we received a message, December 7th is when testimony is due, latest will be December 20th.
Great.
Yeah, so Deb and Samantha, let me just add a couple things. Just as a reminder to those on the call, you've received our notifications about the WEDI PAG, the policy advisory group that's going to be meeting on Wednesday, November 7th at 10 o'clock in the morning at the Kaiser Center for Total Health near Union Station and the U.S. Capitol in Washington, D.C. And it will be a 10 to 4 p.m. Meeting. And that is when we will be looking at all of the recommendations and providing and having a discussion, Deb, about the NCVHS recommendations and the predictability roadmap. We in turn then will take the recommendations and pull together the dialogue from that meeting, and we will be then feeding that information into the formal testimony that will be submitted at the end of November. And then Lori Darst will be participating along with others in a roundtable discussion on the 12th and 13th of December. So that's our process within WEDI. And so we do have several opportunities to provide feedback, and we look forward to everyone's participation in next week's meeting, but certainly as we gather the material together that goes into our formal recommendations back to NCVHS, and then the participation at the roundtable on 12th and 13th of December.
Thank you very much for that addition, Charles, and I will be following up with all of the webinar attendees with an easy way for you to register for the PAG if you have not already done so. Another question that we've had come in, do you have thoughts or direction on what the scope of work will be for the DSMO replacement organization?
Well, that DSMO is really going to oversee all of the standards organizations as the DSMO did today. So if you think about all of the functions that the current DSMO had, you'll take that into consideration, and then that DSMO didn't work. So what would have worked, and what things should they have been doing, and what kind of authority should they have had in order to make them more successful? So somewhat of a dissecting process to say, well, what didn't work with the DSMO, and what do we need going forward? And maybe it's nothing. So maybe it could vary from a very loose to a non-existent thing to a very tight and controlled type of a organization. So we're really trying to get from the industry what they think we need. We thought that the DSMO way long 2 decades ago was the way to go, but then it just didn't pan out. So basically, we're open to the industry's evaluation of that process and that stewardship level.
Thank you so much, Deb. And that's it for questions that we have typed in so far to the webinar. Is there anything else after addressing all of these questions that you would like to add, or anything, Deb?
Nope, just that, even though you're going to, participate in the PAG, feel free to even do your own comments and your own testimony and send that information to us. We will be considering all of that as we formalize the recommendations and firm them up. So please make sure that your comments are known. Give it some thoughtful insight within your organizations. Of course, we get recommendations from the WEDI PAG, but then that may not be specific to an organization or a sector of the industry. So it is very important that we get folks' input into this process. So please feel free to comment.
Yes, thank you very much, Deb. It's very important. We need your input, and again, we definitely want you to attend the WEDI PAG. That will be held next week in DC, and I'll be following up with more information on how you can register with that. Charles, or the rest of Jay and Lori, does anybody else have any closing remarks?
Only to thank Deb for her time today and for the great work that NCVHS has been putting into this, and the work of the NCVHS and as well as Lorraine Dew, who's devoted a great deal of time to this. And we thank you, and we look forward to continuing to be a part of the discussion.
Great.
So
thanks you.
Again,
thanks
Deb.
for continuing to be part of this. Thanks.
Thank you, everybody, for participating, and I hope you enjoy the rest of your week.